Joining us next is Dr. Cosima Karlburger. She graduated from UNSW and trained in both medical and surgical fields. She's the founder of Dr. Cosima MediSpa and specialises in advanced treatment techniques and cutting-edge technology. Please make her very welcome.
Thank you. Thank you. Yeah. Thank you so much. Okay, welcome everybody. Nice to see a few familiar faces in the audience here. I've been doing this for a little while now, and I'm honoured to present and be a speaker here for a very special, unique technology in collaboration with a colleague of mine from the US, Dr. Cheri Frey, who sends her apologies. She unfortunately couldn't be here. She's a board-certified dermatologist in Washington, DC. So we've got a long-distance collaboration, and my disclosure is that I have been sponsored by Aerolase in the US to be here today. So the reason why, the elephant in the room, the question is why? Why am I here today? Speaking for Aerolase, good question. This journey began about 15 years ago when I first started in cosmetic medicine. I was one of probably the very few people that started. Back in the day, we all remember laser clinics when they were very first beginning. Now they're huge. That's how old I am. And I started injecting, didn't really have much interest in skin. 5 years into my career, I was thinking, okay, there's got to be more than just freezing and filling. Now, technology has advanced. Everything is moving more towards devices, skin, health, rejuvenation, rather than just filling and freezing. So about 5 years ago, I started investing into technology. I was looking for something that could help my patients feel better about themselves, and I thought, okay, something like an IPL seems to be, the gold standard to treat a lot of things. And there's companies out there where you can tighten, you can lift, you can treat redness, and you can treat pigmentation. Now, 5 years ago, I wasn't that educated in technologies. I'm not a physicist. I'll tell you all a secret. I failed physics in high school. Very disappointing. Not great at it. But since then, I have changed a lot, and I've done a lot of research into technology. And what was happening with my patients was I was seeing results, seeing some really, really, really good results with the technology. But then there were those other cases, those, few outliers that were becoming more and more common to see. And I thought, I can do better than this. I want to be a front runner. I really want to make a difference in people's lives. So I started looking further afield. I spent about 6 months in Australia researching technology that was available here that could achieve the results that I was looking for. And I just really wasn't 100% convinced by anything. So luckily, a colleague of mine went to IMCAS in Paris and flagged a particular new technology that wasn't available in Australia at the time. We're very lucky it is now. And that's where the story began. So the particular interest that I draw for this technology is related to rosacea and skin of colour. Now, a lot of technologies that we use these days for rosacea can have rebound effects. For example, once you stop your medications for treating rosacea, we'll see that the inflammation comes back, the pustules can come back. If we are using topicals, they work well whilst you're using them, whilst you're on them, but it can also rebound. And the technology with the lasers may actually not be suitable for all skin types and all Fitzpatrick's types. So what we're seeing is that these technologies, these treatments are not suitable for everyone. And obviously we want to be inclusive. We're a multicultural land, Australia. We've got people of all different skin types. And so looking at a technology that can treat rosacea in darker skin types as well was really important to me. Now, rosacea in skin of colour patients does look a little bit different. we're used to seeing probably in the Fitzpatrick's 1 to 3s, it's very clear, you can see that erythema, you can see the flushing, you can see that pinkness on the cheeks. In skin of colour patients, especially when you're moving on to a Fitzpatrick 5 or 6, what can happen is that the person feels flushing, they feel warmth in the skin, they feel sensitivity to products. They may think they're having acne breakouts, but in actual fact, it's the inflammation in the skin that's causing it. And often we don't recognise it because when we first see it, it looks like a couple of little capillaries maybe, and we think, oh, yep, that's, you know, someone that just has that little bit of background. That's a normal aging process with those capillaries and telangiectasia. But often it's not until the phymatous changes or the pustular rosacea actually becomes really severe in darker skin types, where we're seeing it very significantly obvious on the cheeks, on the nose, on the chin, skin thickening, where we actually then recognise it needs significant treatment. Rosacea in the skin of colour patients, that slight flushing and redness is something that becomes a little bit clearer over time, but obviously the melanin does mask that. And then overuse of lightening agents, which is very common once the rosacea has created some of that hyperpigmentation, can create even more sensitivity and mask that diagnosis even further. Now, in terms of treatment and safety and efficacy for all skin types, what really, really resonated with me was this 650 microsecond technology with the Nd:YAG. Okay, that is unique in its class. There is no other 1064 Nd:YAG that has that 650 microsecond technology. Why is this so important? Because the thermal relaxation time of the skin is approximately 700 microseconds. Who knows what thermal relaxation time means? Hands up. Yeah, a couple of people. I really didn't know for a very, very long time. And if you're not so into lasers and you don't know and you haven't sort of delved deeply into it yet, it's not something commonly known. But what it means is that it's the time taken for 50% of residual heat into the skin to dissipate after a thermal treatment. Now, okay, why is that relevant? I think is the more important question. Because most 1064 Nd:YAG devices have a pulse duration that is much longer than that. What does that mean? It means that there's a lot of heat, a lot of collateral heat spread to other tissues nearby rather than just the target tissues. So again, that's where the importance of something like a 650 microsecond pulse duration comes into effect, because we're just targeting the chromophore specifically without creating damage, collateral damage to surrounding tissues by heat that cannot be avoided due to pulse duration. Now, a really simple way, and this is how I first thought about it. So I love analogies because that's how I get my brain around physics. The finger in the flame, okay? You have heat energy. You have your finger. You put it in the flame for a really long time, it burns, okay? It hurts, it gets red, it blisters. What we can do, if we put our finger in really quickly and pull it out, it's like magic. It doesn't hurt, doesn't cause burning, doesn't cause collateral damage. It's still creating the energy though. Now, importantly, we do need to create enough energy that it helps to coagulate the target vessel. So, Aerolase has created this technology that can give high power, like a high power Formula One fuel pit stop, into that short pulse to create that coagulation effect safely and efficiently. So that's a really good take-home message. I always used to remember things by little slides and images and take-home messages like that, so I hope that helps you guys. Obviously, 1064 is the wavelength that is attracted to hemoglobin. Now we can see a lot of technologies that are used predominantly for treating rosacea are in the 500 nanometer spectrum. But again, the uniqueness of being on the 1064 spectrum is that it is the deepest penetrating laser wavelength available for treating redness, rosacea, and the chromophore that we need to target at a deeper level. And coming back to it, this is why I was finding that I was having patients with my IPL that were having rebound redness. So some of their flushing improved, they'd come back, they'd had multiple treatments, and we didn't find significant improvements. Obviously, some people will improve because their problem is more superficial in the skin. But when we need to get down to the deeper layers of the dermis, we need to have a wavelength that can penetrate all the way through. So looking at the 650 short pulse 1064 Nd:YAG laser, it's a collimated beam. It penetrates deeply down to the bottom of the dermis. It reduces any collateral damage to the tissues so that the heat doesn't dissipate because it's very targeted, high power, short pulse within that vessel, within that target chromophore, so that we're not causing the redness, the downtime, the burning. We're not having to cool the skin with this technology. So again, the trilogy of safety and efficacy in a 650, 1064 nanometer Aerolase Neo-Elite type laser. The short pulse of the 650 microsecond creates a fast impact without collateral damage. The high power coagulates the vessel safely and effectively in darker skin types because it doesn't have that heat effect. And the wavelength of the chromophore is the 1064 that penetrates right down to the base of the dermis. Okay. So the case study that we conducted in collaboration with Dr. Cheri Frey was a patient in her 40s, a Fitzpatrick type skin type 5. She had a 60% coverage of inflammation and sensitivity in the skin, which we used a skin analysis scanner to achieve that precise percentage. 3 treatments, 3 weeks apart with the 650 microsecond technology Nd:YAG. A lower joule was used, obviously, because she was a Fitzpatrick skin type 6, so between 11 and 18 joules per square centimetre. In a Fitzpatrick that's slightly lower, so a 1 to 3, you would probably double that energy, which the Aerolase can do. Then the vessels themselves were targeted with a smaller diameter spot size, 5 millimetre, with, again, higher energy levels for a Fitzpatrick type 5 and 6, but lower energy levels than, much lower than what you would use for a Fitzpatrick 1 to 3. So for example, the energy that this device, 650 microsecond Nd:YAG 1064 can produce is over 200 joules per square centimetre. So very, very high power. Now, the exciting part about the result for me, because this made it all worthwhile, my whole journey, my whole investments worthwhile, was this result. 60% down to 20% inflammation in the skin. So for this patient, this is something that was life-changing. For her, she'd tried other treatments before that hadn't had this effect. And in this case, 40% reduction in inflammation for a rosacea patient with a Fitzpatrick type 5 skin was incredible. So in summary, using a technology like a 650 microsecond 1064 Nd:YAG to reach the deeper layers of the skin with that short pulse, high power, capabilities of not injuring non-target tissues that have collateral damage, with risk of PIH, burns and inflammation and scarring. It's just been a game changer for my clinical practice and for my patients as well. So hopefully if you find that interesting, come ask me. I'd love to share more information with you. Thanks everyone.